Let me first congratulate NIAA and the Planning Committee for putting together what I think has been a superb and important and very timely gathering. Now, one of the challenges involved in giving the last talk is trying, as you're putting it together, to anticipate what other people might or might not say. So you're going to see me run through a number of things that you've already heard, and I'll try to emphasize some points, and there may be a few things in here that haven't already been said. I have no relevant conflicts related to this presentation to disclose. So the outline, the problem, very briefly, it's been very well laid out. The challenges that we face, many of which have been discussed, and the opportunities that we have right now to move forward on this issue. The Institute of Medicine back in the early 1990s put together an expert committee focused on concerns about disease emergence and reemergence. If you wonder what that is, the ongoing Ebola outbreak is a very good and timely example of one of these. This committee was co-chaired by two very eminent infectious disease and microbiology professionals, Nobel laureate Joshua Lederberg and Robert Shope. This report's very important in a number of ways, but one is it provided a definition for emerging infections. And I thought I'd just briefly share it with you. New, reemerging, or drug-resistant infections whose incidence in humans has increased within the past 2 decades or whose incidence threatens to increase in the near future. So a very broad definition, and one even in 1992 that specifically included emphasis on the problem of drug resistance. That 1992 report shown on the left in this slide identified 6 factors that the expert committee felt were important in contributing to disease emergence and reemergence. I've highlighted 3 of those 6 because they're directly relevant to what we've been talking about. Human demographics and behavior, international travel and commerce, as Tom just pointed out, microbial adaptation and change. The phenomenon that's really unique to infectious diseases and the reason why we keep seeing new and emerging problems. In the early 2000s, the IOM revisited this issue of emerging infections. This committee this time was led again by Dr. Lederberg, and very importantly for you to know, Dr. Margaret Hamburg, Peggy Hamburg, Commissioner of FDA, served as co-chair of this committee with Dr. Lederberg. So she has a very detailed understanding of these issues. That committee validated the 6 previous factors and added 7 more that contribute to disease emergence, one of which I've highlighted, the increasing human susceptibility to infection as the population ages and new therapies are available to treat people with severe underlying diseases. In 1993, the Washington Post had a commentary, the headline of which was running out of wonder drugs and raising this concern that you've heard about returning to the pre-antibiotic era. The Infectious Diseases Society of America, IDSA, in 2002 issued its Bad Bugs, No Drugs report, pointed out that in 2002, out of 89 new drugs for human use approved by FDA, no new antibiotics were included. This gets at the drug development pipeline problem. Tom Chiller just used this slide, was a very noteworthy event. WHO in 2011, for the first time, devoted the World Health Day theme to the issue of combating drug resistance. I've always liked the tagline that they put together for this because it really captures the problem very nicely. No action today, no cure tomorrow. Now, moving to the challenges. Public health surveillance, we've been talking a lot about this. It's the ongoing systematic collection, analysis, and interpretation of outcome-specific data. However, it doesn't stop there, and I think this point has been repeatedly emphasized during this meeting. It needs to be closely integrated with the timely dissemination of these data to those responsible for taking public health action to prevent and control disease or injury. So at CDC, we think of this as information for action. This is a slide that we put together back around World Health Day in 2011. In the upper left, you can see some of the increasing trends in resistance in important human pathogens that you've already seen various depictions of. On the right, you see the drug development pipeline, and making the point it's new drug approvals by a 5-year period. And you can see the dramatic decrease in the rate in which new antimicrobials for human use become available. This pipeline issue is an example of a market failure and an innovation gap. You've heard in detail about the CDC Antimicrobial Threats Report. As you have heard, drug-resistant non-typhoid salmonella and campylobacter are included. In addition, I'd call your attention, those are serious threats. And in addition, I would call your attention to C. difficile right at the top of the list, listed as one of the urgent threats and its consequence of antimicrobial usage. WHO antimicrobial resistant priorities, the priority pathogens are shown here, and in particular, fluoroquinolone resistant salmonella is included. In the 2003 IOM report on microbial threats to health, the sequel to the Emerging Infections report, there's a quote that I wanted to share with you. A robust public health system in its science, capacity, practice, and through its collaborations with clinical and veterinary medicine, academia, industry, and other public and private partners is the best defense against any microbial threat. So that committee particularly highlighted the important role of the veterinary profession in recognition and response to these emerging microbial threats. Following the initial 1992 report, the IOM put together a forum on microbial threats. Dr. King, who you heard from at the beginning of the meeting, and I both have the privilege of serving as co-chairs of that forum. The forum has frequently discussed antimicrobial resistance and food safety issues. These are two reports of relatively recent workshops, the one on the left focused on antibiotic resistance, and the one on the right focused on food safety. And you notice even the title of the workshop emphasized the importance of the One Health approach. So this factor, microbial adaptation and change, the selective pressure that the use of antibiotics provides, is highlighted again in this slide. The cartoon there on the lower left is the opposite of judicious antimicrobial use. The caption, you may not be able to read, says, "Don't forget to take a handful of our complementary antibiotics from the fishbowl there on your way out." I use it because it makes the point, as we've heard repeatedly, that there are many problems on the human side with lack of effective antimicrobial stewardship. IDSA, which is the professional society that has about 10,000 members representing people involved in clinical practice, in academia, in research, or in public health, and representatives from industry who are focused on infectious disease issues. For IDSA, this problem of antimicrobial resistance is the #1 priority. They put emphasis on surveillance of use and resistance in both humans and animals, on antimicrobial stewardship, and importantly, the need for new drug development. This is a report that summarizes the recommendations made by the society, and I don't want to go through all of them. I've highlighted just two. The focus on enhanced surveillance systems, both in human health and animal health, and the elimination of non-judicious use in animals, and which we've been focused on, but there are also issues we should remember in plants and in marine environments. Here is a slide showing the CDC Get Smart program. I actually wasn't aware of the fact, I've been gone from CDC now for almost 10 years, I wasn't aware of the fact that the Get Smart program had been discontinued. Hopefully, there'll be an opportunity, if when additional funding comes to CDC, for them to reinvent or reinvigorate that program focused on antimicrobial stewardship in the community. A recent issue of the journal Clinical Infectious Diseases contained a workshop on antimicrobial stewardship in human health. It contains the proceedings. If you're interested in learning more about the human side of stewardship, I would commend this to you. It's the October 15th, 2014 issue. You've heard actually about some of these elements before. It's action-oriented. It's focused on surveillance, education, and data sharing, this transparency issue that we've been talking about. In the biomedical world, there are a number of game-changing events and technologies playing out. One is this shift from culture-based diagnostics to what's called culture-independent diagnostic testing. I'm not sure this has been mentioned during this meeting. It's a real concern to CDC and others in public health because, as you know, we've been relying on bacterial isolates as a source of data on trends in antimicrobial resistance. CDC and others, public health lab directors, are focused currently on looking at ways that we can respond to this change in technology and preserve our ability to monitor antimicrobial resistance at the same time. Now, other aspects here are even more encouraging. The use of whole genome sequencing that we've heard about, bioinformatics, the move toward healthcare reform and opportunities that that may present for improving surveillance. Electronic health records, it would certainly be nice on the human side if these were integrated in an effective way, but there's a lot of work to do there. The use of social media in terms of monitoring resistance or trends in resistance, but also in consumer interests and concerns is an asset. And then finally, this gradually increasing appreciation for the importance of the One Health agenda in human medicine. You all have been way out in front on promoting the One Health agenda, and the medical profession, I'm sorry to say, has really lagged. I always use this slide when I talk to medical professions. We don't need to belabor it here, but the interface between human health, animal health, and ecosystem health, as emphasized by the One Health agenda. You'll notice wildlife down there at the bottom. We haven't been talking about that, but certainly for Ebola, that is a major risk of, in terms of being the source of introduction of Ebola virus and other viral hemorrhagic fevers into communities initially in faraway places. I like to point out to medical audiences that there's a lot of common ground for medical and veterinary communities. And I'm not going to read this long list to you, but you see the extent of potentially common interests. Right at the top of the list, of course, is antimicrobial resistance and usage issues. Down in the middle is foodborne disease and healthcare-associated infections. The next couple of slides include brief summaries of the executive order, the CARB strategy, and the PCAST report. You are all experts on these by now. We've heard about them. They're recent, they're timely, they're important, they're collaborative. The interagency task force that the executive order calls for is to be co-chaired by the secretaries of HHS, USDA, and DOD. And as we've heard, the National Action Plan needs to be developed by February 2015, so there'll be many people working feverishly over the holidays on that, I am sure, and my condolences. But it makes the point, these executive orders, I can speak from my previous experience, these things are really important. I mean, this is coming from the president, and it's telling the federal agencies what needs to be done, and it gives them timelines, as we've already heard. And they are taken seriously, and these are monitored, and there is accountability here. So stay tuned. The national strategy on combating antibiotic-resistant bacteria, again, you've heard about. The only point here is right at the bottom of the slide. It includes a mention of a $20 million prize for the successful development of rapid point-of-care diagnostic for highly resistant bacterial infections. This makes the important point about the importance of developing and introducing rapid point-of-care diagnostics for use in humans and, when appropriate, for use in animals as a mechanism for more effectively targeting appropriate antimicrobial use. And then finally, PCAST, the high-level expert advisory committee that has recommendations very consistent with the other two documents, and among other things, it calls for decreased use of antibiotics in animal agriculture. And I thought that the slides that Dr. Granger showed with the language from that report was very important to be aware of and pay attention to, because it puts in perspective concerns about the problem on the one hand, but some of the uncertainties and gaps in knowledge that exist. So the ways forward for shared stewardship: replace the use of antibiotics when possible, both in human medicine and animal medicine and agriculture. Reduce the use of antibiotics when possible, human medicine, and here's where stewardship programs come in, animal medicine and agriculture, and we've heard about approaches planned to do that. And then refine the use of antibiotics when possible, human medicine, again, antimicrobial stewardship programs, and animal medicine and agriculture, and the move toward requiring veterinary oversight is a big step in that direction, I think. Needs for moving forward, and again, this action orientation that has been emphasized, I think, is really important. Continuing the dialogue, demonstrating a willingness to listen, getting access to better data on use for humans and animals, and I strongly agree with the theme that it's time to get beyond sales data to use data. This slide suggests a partnership between USDA, FDA, and CDC equivalent to NARMS for developing mechanisms for and monitoring antibiotic usage over time, and I was encouraged to hear about the interagency committee that's focused on potential new methodologies for doing this. And then finally, communication, adopting a One Health approach. We need to continue to work on the medical side of the house on that. And then research. There are a lot of gaps. We need better quantitation, as we've heard, of the relationship between agricultural use and resistance in humans, as well as resistance in animals. We need alternatives to antibiotic use in human and veterinary medicine and agriculture, and here's where some of the research agenda comes in. And we need better ways to implement stewardship in human medicine. Tom Chiller mentioned the Transatlantic Task Force on Antimicrobial Resistance. Here's just a new activity, which I understand has recently been added to their agenda, and that is to establish a joint working group of international subject matter experts to identify key knowledge gaps in understanding the transmission to man of antimicrobial resistance arising as a result of the use of antimicrobial drugs in animals, and on the development of effective intervention measures to prevent this transmission. So finally, concluding remarks. I certainly agree with the emphasis placed on this being a very complex, very multifaceted problem. And the fact that we're all in this together. I've been very encouraged by the tone of this meeting. I think there's clear evidence that we're moving beyond the blame game. There's plenty of game to go around in this arena. And we need to, rather than spending time doing that, we need to really focus on the issues and figure out how to move forward. It's absolutely essential. The table's been set. You've seen all these reports, and then the executive order and the national strategy and the PCAST recommendations. There's never going to be a better opportunity to address these issues. It's critical we collaboratively develop and identify priorities and develop metrics. There's a need for shared commitment to antimicrobial stewardship. I suspect that there are lessons learned in the human world that might be relevant to the veterinary world and vice versa. We need the shared commitment to development of better data on usage and resistance in various settings, and we've heard that over and over again. I certainly agree with that. We need a research agenda, and I think it'd be nice if we had a collaborative research agenda where there were people from human health and animal health and environmental health actually represented in these discussions to see what can be identified as a consensus, if you will, regarding the importance of addressing specific research questions. And then finally, we need a shared commitment to communication and collaboration with professional societies, with public and private sector partners, and with the public, and I think that's been appropriately emphasized through the meeting. So